Welcome to the deep dive. In this deep dive, we're diving into a topic that's close to my heart, Down syndrome and oral care. We've got some great material to unpack here. So consider this your cheat sheet to mastering some really important stuff.
I like that, a cheat sheet.
Right. Okay, so our source material kicks off with a very simple explanation. Down syndrome happens when someone has an extra copy of chromosome 21. And I know what you might be thinking. A chromosome. How does that affect someone's teeth?
It's a great question, and it highlights this really important point. That extra chromosome, it doesn't just affect teeth, it impacts the development of the whole body, and that includes the mouth.
It's like that extra chromosome throws, it throws a wrench in the works, so to speak. It changes how things develop.
Exactly.
Okay, so speaking of changes, the source mentions this thing called delayed eruption. Basically, teeth might show up a little late to the party for kids with Down syndrome.
Yeah.
And they even gave this example, a 2-year-old without a tooth. That can be totally normal.
Right. It's a great example of why we need this information. Otherwise, we might misunderstand what's going on. Like a delayed tooth eruption might freak a parent out, right?
Yeah.
But when it comes to Down syndrome, it might be totally typical. That's what we're hoping to do. Give you the knowledge to understand those differences.
It's like that insider info. So you could approach those situations and be like, okay, I know what's up.
Yeah.
And it's not just about when teeth appear, right? Our source material talks about all sorts of other differences in the mouth.
You're right. We see a lot of variation in the teeth themselves. They can be smaller, shaped differently, and the tongue. It can often be larger. Even the palate, the roof of the mouth, that can have a different shape.
Wow, so many variations.
Yeah, and here's the thing. I don't want to just list these differences off like we're reading a grocery list.
Yeah.
The exciting part is understanding how they actually affect a person's life.
Okay, so let's dive into that. So what factor then? For instance, a larger tongue. That's not just an aesthetic difference, is it? It can impact how someone speaks, eats, even how well they sleep.
Exactly. Think about how one thing can lead to another. If a child has trouble making certain sounds because of a large tongue, that might lead to frustration, maybe some social anxiety, right? Maybe even difficulty with certain foods because of how the tongue interacts with the teeth.
Wow, that's a great point.
We're going beyond simply listing the differences. We're all about exploring how those differences actually play out in someone's life.
I like it. It's all about implications. And it's not just the tongue we have to think about. The source material also mentions something about shorter tooth roots in people with Down syndrome.
Right. They do tend to have shorter roots.
And then on top of that, there's higher risk for gum disease. It's like those teeth are up against it from all sides.
Yeah, it's true. Those teeth can be more fragile. So early intervention is super important. And we're not just talking about, brushing twice a day. It means a lifetime of specialized care that starts early.
So it sounds like finding the right dentist is crucial.
Absolutely.
Because all these unique considerations we've been talking about, well, they require a unique approach to care, right?
Exactly. And that's where that specialist dentist comes in. We're not talking about just any dentist, but one who really knows their stuff when it comes to Down syndrome.
Now, I'll be honest. I wouldn't know where to start with that. How do you even find a specialist like that?
Well, luckily, our source material had some tips on that.
Okay.
They recommend checking with local hospitals. A lot of times they'll have dental departments that are used to working with special needs. And then there are also dental associations specifically for people with disabilities.
So those are good resources to tap into.
Exactly.
But what makes a dentist, the right fit for someone with Down syndrome? Is it just about having the right training?
It's definitely more than just the technical stuff. It's also about understanding the anxiety that someone with Down syndrome might be feeling, in that kind of setting. It's about being patient, compassionate, and willing to go that extra mile to make it a good experience for them.
Because even for someone without those extra challenges, going to the dentist can be a little stressful.
Oh, totally.
Right.
Yeah.
So when you add in things like sensory sensitivities or maybe some difficulty communicating, it really highlights how important it is to find the right person for the job.
For sure.
So we've got the specialized care covered. But our source material goes even further.
Yeah.
They give some tips for how to make the whole dentist experience less daunting.
Oh, I love that.
Which I am all for.
Me too. Those tips are so valuable. It all comes down to preparation and communication. The source material talks about explaining everything beforehand, even doing some role playing to get the person used to the sights and sounds of the dentist's office.
It's like anything else, practice makes perfect.
Exactly.
The more familiar something is, the less scary it seems.
That's it.
So it's not just about preparing the person with Down syndrome, But also about talking to the dentist beforehand,
Absolutely.
letting them know about any concerns or sensitivities.
Exactly. That way the dentist can adjust how they do things.
So it sounds like a team effort. The individual, their support system, and the dental professional all working together.
That's the ideal scenario.
Because when everyone's on the same page, things go much smoother.
Exactly. And you know what else the source material mentioned?
What's that?
Routine. Establishing a routine can make a world of difference.
Routine is so important. It's like, that favorite comfy sweater you always go back to.
Yeah, it gives you that sense of security and familiarity. And when it comes to the dentist, that familiarity can make a huge difference. Regular visits, even if they're short ones at first,
Yeah.
they help build that comfort level over time.
Like, it's not so scary anymore.
Exactly.
Well, this deep dive has definitely made me feel more comfortable. About Down syndrome and oral care. That is,
I'm glad to hear that.
it wasn't about cramming a dentistry degree into our brains or anything, but more about giving us the tools to advocate for what's best, whether it's for ourselves, our kids, or someone we know.
That's what we were going for.
But it got me thinking. We've talked about the higher risk of gum disease and finding the right dentist and making those visits less stressful.
Right.
But what about making oral hygiene itself more engaging? Like, what if brushing and flossing weren't chores?
That's a fantastic question, and it's something we should all be thinking about.
Seriously.
How can we help individuals with Down syndrome really take charge of their oral health in a way that's, fun and empowering?
That is a challenge worth exploring.
I think so, too.
And on that note, we'll leave you with that thought. Until next time, keep those minds curious and those smiles bright.